My name is Kavita, and I'm an employee here at Halo and a patient that got hereditary cancer genetic testing done. So I come from a family with a wide prevalence of cancer, including my mother, aunts, and grandfather. Just seeing how my family and members struggled with cancer, all the unknowns during and after their care, I figured that getting genetic testing was something that I needed to do. And regardless of the results, I was really going to be better informed about my genetic makeup and be able to make better decisions about my health, whether that meant doing something different or continue doing what I was doing. I did have some concerns when I was taking the test, and also before taking it. I was always left with the hope and the comfort that if something was positive, I could act on it and I could do something different with my health care, and maybe avoid going through what my family's members had gone through, because cancer is scary in itself, and going through it and seeing other people that you love go through it is really tough. So I relied on that comfort that knowing my results was the better option rather than not knowing and living in doubt. So while I was waiting for the results, I had days where I would feel scared that something might come back positive and potentially change my life completely. But I always kept the hope that if this were to happen, at least I would be able to get ahead of it and prevent the suffering that I have seen my family members go through. And not only for myself, but for my kids if I have any in the future, because there is a 50% chance that they could inherit that. So I received my negative results, thankfully, and this gave me a lot of peace, and quieted that thought in the back of my mind that whether my family member's cancer was hereditary or not, it was just even more reinforcing to me of how important it is for me and my family to stay on top of our screenings, whether that be keeping them accountable about going to their mammograms, MRIs, colonoscopies, procedures that we find discomfort in. It's very important that we keep up to date with those, because the reason for those is to detect things earlier, to help course correct or treat something early on so it doesn't get to the stage of spreading or impacting our lives even more. When I shared the results with my family, I could see the relief in their face when I told them that I was negative, especially those that had cancer themselves. I remember a conversation specifically with my aunt where she was just so comforted herself, and she told me that she felt really good that I wasn't carrying a genetically higher risk, and that there were things that I could do to prevent what she had gone through, and it meant a lot. I would advise anyone with at least one family member that has or has had cancer to talk to their doctor about the possibility of testing. Bringing it up to them is a really good way of helping them guide you through what the next steps might be. There's definitely something that you can do about it, so don't let the fear of whether it's positive or negative stop you from being more informed about your health, and being able to actually make decisions that are right for you and the care that you need and deserve. My overall process with genetic testing through Halo was very educational and empowering. I learned more about myself and my risks, and now I can talk to my doctors about this, and eventually my children if I choose to have any, and make better decisions overall for myself and my family. So it was an amazing process, and I came out a lot more knowledgeable, not only about hereditary cancer testing, but also about myself, and what I should be doing for my own health and well-being.